Hi, this is Dr. Doreste with the Cranial Release Technique, back with another video, a Sunday morning video on a rainy, cloudy day here in New York. A little bit cooler, so that's a good thing. It's been cooking up here. So I wanted to touch on a concept that I wrote about many years ago, and I think most practitioners maybe don't think much about it, don't really have techniques to address it, and that's what I wanted to talk about, and that's our friend, the dura mater. If you remember, we have and you've heard me say over and over, and you've heard if you watched any of these videos, we have the 22 bones in the skull. Those bones remain separate. Those bones need to move. That's normal. That's natural. As a matter of fact, some people believe that that's the energy system and the health regulating system of our body, so much so that the discoverer of cranial work, Dr. Sutherland, over 100 years ago, termed that movement the primary respiratory mechanism. He felt that that movement of the cranium, expanding and contracting, all 22 bones opening and closing, was the key factor to determine how healthy the patient is at every level. Remember, according to Gray's Anatomy, the central nervous system, the brain and spinal cord, controls every function of the body. So if you're sitting there at home and you're complaining of a leg problem, a kidney problem, a shoulder problem, a skin problem, a menstrual problem, a whatever problem, there must be a neurological component to that, since it's the neurology, it's the central nervous system that controls the functioning of it. Sure, there is a time where the knee might need to be looked at and the knee might need to be addressed because that's where it hurts. But there could also be secondary, or actually in my book, primary reasons for that knee. The knee might be the secondary reason. The knee might be wearing out secondary to a cranial issue. And we'll talk about that maybe a little bit later. I came up with a term called the Dural Stress Syndrome many years ago. And what I meant by that was, I'm looking at the body as a total global unit. And so if the cranium is out of balance, and you might be saying to me, what do you mean? Well, how's the cranium out of balance? Well, all you need to do is go look in a mirror, take a selfie of yourself, ask your wife to stand in front of you, or your husband, or your kids, or your mom or dad, and look at them, or have them look at you. And look at the eyes. Does one eye, one orbit, one bony orbit look smaller than the other, right versus left? You can look at each other and ask that question. Does one eye look lower than the other in the head? Physically look lower, right versus left? If you very gently took your thumbs and placed them under the cheekbones, the maxillary arches, does one of those bones look lower, right versus left? You can look at the ears. You can even be daring and place your fingers in your ears or someone else's ears and ask yourself, does one ear look lower than the other, right versus left? Does one ear look more forward or more back, right versus left? And if you answered yes to any one of those questions, and you're probably going to answer yes to at least one, then you could probably say with reasonable certainty that you have cranial distortion, which we all do. It's probably been there since the birth process, because when I look at children, when I look at babies, you'll see the same distortion. As a matter of fact, in one of my other videos, I would encourage you to go back and look at your graduation picture, your kindergarten picture, your baby picture, and look at yourself from a cranial release distortion standpoint, and you will see distortion. So that person that now comes into me, or to you if you're a practitioner, and says, I'm a 40-year man and they suffer with blank. I have knee trouble, I have back trouble, I have skin trouble, I have digestive issues, I have breathing issues, I have fill in the blank, whatever. Understand they're complaining of the spot that's giving them trouble, either symptoms or someone else told them they have a problem there from some other testing. And that may very well be true. But the question then is, what about the central nervous system and the central nervous system's control of that area? So I used to talk about the dura mater back in my seminars and even with my patients. And I'll give you a brief explanation of what I'm talking about. So as that cranium shifts and rocks, as you look at the patient or yourself and you see distortion, understand that the dura covers the brain and is attached. If this is the cranial bone, the dura is firmly attached to the inside of those 22 cranial bones. The dura then attaches to the occipital bone, that's the base of the skull, to the first, the second, and the third cervical vertebrae, the top 3 bones in the neck. And then the dura mater sort of free floats down, attaches into the sacrum, the last bone in the spine, and blends in with the periosteum of the coccyx, the little tailbone. So we have a very firm craniosacral attachment, very firm. In addition to that, we have 12 pairs of cranial nerves. These are the nerves that begin in the brain, pass out from the brain, and according to the anatomist, they pierce through the dura. That's the term the anatomists use. They pierce the dura. 12 pairs of cranial nerves, 31 pairs of spinal nerves. So all those nerves are piercing through the dura. The outermost covering of those nerves that leave from the cranium, from the spine, the outermost covering, like the black plastic on a wire, on an extension cord, which I have here. Let me just unplug this and I'll show you what I mean. That outermost plastic covering that's holding the wire together is really the dura. So that dura goes out, runs along the whole length of the nerve, and also, according to the anatomist, that dura becomes the deep and superficial fascia, and that's a whole other lecture that maybe we'll get into another time. The fascia is everywhere, encases everything, holds everything together. And for those of you that are body workers primarily, that work with fascia and fascial techniques, you know how important the fascia is. And the point I'm trying to make to you is that the fascia is the dura. So now you look at a patient. The patient comes in, hey doc, I have a knee problem, I have an ankle problem, I have a back problem. They have digestive issues, they have a bladder trouble, they have bowel trouble, you name it, headaches, whatever it happens to be. And you look at the face and you see cranial distortion, the way we were just discussing. Now let's talk about the dura. Here's a dish towel. That's about the length of the dura. And the way I picture it and the way I would explain it to my patients is imagine that over those years since the birth process and all the stresses that we're going through in life, that dura is just getting tighter, 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 tighter as the years go on. And remember, now that means that all of those nerves that we discussed, the nerves from the brain, the cranial nerves, 12 pairs, the 31 pairs of nerves that exit the spinal cord that go out to touch everything so that the brain can be in total communication and control, sending messages out, receiving messages back, so that the brain's in touch and in control of everything. Now that whole system is in disrepair because of that dural tension. There's actual mechanical tension, and there's no way that the rest of the body can function properly. I mean, it's It's so complicated that it's simple. Cranial distortion leads to dural tensioning. Dural tensioning leads to misfiring within the nervous system. So what does that mean? Some systems are going to get too many signals too quick. Some systems are going to get too little signals too slow. And there's going to be disharmony in the body. And so the way to address this issue is with the cranial release technique. How do we then go about with a very gentle 1-minute technique, open a line, restore the primary respiratory mechanism, and go back to our friend the dura mater that's under this tension and tension year after year after year after year, and now do something to let it start to unravel. I mean, it's a pretty logical, intellectual exercise to go from cranial distortion to dural tension to malfunction in the body. And then the reverse is true. If you can do something to open, align, and restore the movement of the cranium, reduce the tension on the dura, and allow the body to do what it does best, to heal itself from inside out, that's called cranial release. And remember, the 40-year-old man or the 35-year-old woman or the 82-year-old man that comes into you that complains of X, Y, or Z, understand, in my mind, how long's it been going on there, John? Oh, the last 2-3 weeks. Okay, he's been symptomatic the last 2-3 weeks. But in my mind, it's lifetime. It began probably at the birth process, and I would even say it could begin before birth. We'll talk about that on another video chat. But let's just assume the man's 59 years old. In my mind, it's a 59-year-old problem. He may come in for one CRT and say, gee, I don't know what you did, but that knee feels much better. Oh, that's great. I'm happy to hear that. But this is something in my book. Now, I have to educate him to understand that this is something we need to do on a regular basis to unwind, to let that dura unwind so that you can be optimized. We want that dura to be unwinded. We want that dura to be relaxed as possible. For those of you that are chiropractors, in my opinion, I don't know how you can get to the dura with a chiropractic adjustment. For those of you that are body workers, massage, PTs, trainers, occupational therapists, people who put your hands on each other, work on the fascia, work on the muscles, work on the tendons, work on the ligaments, do all the good things that we do, I don't know how you can get to the dura from that. For those of you that maybe use needles and you balance the patient from an electrical standpoint with Eastern medicine, acupuncture, I don't know how you can get to the dura either. Continue doing what you're doing. Don't stop. I'm on your side. We're all on the same side. We're trying to help the patient from the inside out with what we're doing. But to me, nothing does it that I have seen, that I've experienced in almost 40 years of practice, like cranial release technique. You know the website, cranialrelease.com. You know there's a button there that said online training. Feel free to click on that. Learn more about the online training and how you learn this. Keep up the good work. Now it's the middle. Today is July 16th. So we're here in the middle of summer 2023. Might be a good time for you to invest the time, energy needed to learn the cranial release technique so that by September, when school and work resumes and it's time to go back into the real world and get out of the summer break, what a great thing, Labor Day, to start introducing cranial release technique into your practice. Just a thought, you might want to consider that. I was telling my wife the other day, 5 years from now, I may still be doing these videos. And I'm sure people are going to be out there and say, my God, this guy is still talking about the same damn thing every time about the cranium and the dura and optimizing health. Maybe instead of waiting 5 years and learning it then, maybe learn it now so you can start helping people now have a very stress-free practice, help people at a very deep level, see more patients if that's what you want, earn more profits if that's what you want, do all the things, get the fun back into practice, have fun again. And you can do that with the cranial release technique. Cranialrelease.com is the website. Dr. Doreste saying adios. Enjoy your Sunday. Enjoy the rest of the summer. Speak to you soon. I hope to see you over on the website, cranialrelease.com, or that online training program. I'm there as well. I'm going to personally lead you through everything you need to know about the cranial release technique. This is Dr. Doreste saying thank you, my friends. Be well. Adios. Enjoy. Goodbye.